This is Consumer's Doctor on the behalf of Foremost Organization. It has been a while I have not been streaming live, but I had to do what I had to do is talk about healthcare. Talk about healthcare. Every time I get a chance, I talk to people on healthcare. The other day, somebody, came with an idea, why is it so costs of the healthcare are so high? Nobody could give a single answer. It's very simple, folks. It's very simple. Unless consumers are in control, no one, no one, not in the government, not even no one has the capability to lower the costs. I'll tell you why. Cost first, consumer has to demand. Consumers have to demand segmentation into four categories. Why is this? Your insurance premium, you're based on all 300 million Americans. It is not acceptable. The premium has to be focused on you. If you don't see a doctor, if you do not see a if you don't use any healthcare facility, if you're healthy, if you're 30 year old, you don't, why is it should be more than 50 to 100 bucks of insurance? It should not be. It should not be. So that's called health. The category is if you're healthy, your premium should not be anywhere from 50 to $100. You mean to say people can't afford 50 to 100? I understand small segment, but people, or working class or even lower income category, this should not be more, and they should be responsible for their own health. So this is called well category. So your premiums have to be based on well category, and it has to have a deductible segment to it so that you can qualify for health savings account. If you have a deductible of $1,000 or $500, it doesn't matter. Then you qualify for a health savings account. If you want to lower your premium, obviously you have to go for a higher deductible. But on the long run, having a higher deductible, you can afford it after contributing few years. This is a win-win for the employers and employees. This is not, I'm not suggesting this is a good, um, I would say this is good for both employer and employee. Today I was talking to one of the supervisors at the Chamber of Commerce, City Hall. I was they have so many employees they don't have. They have insurance, but they don't know what exactly they're paying for. They have no idea what. See, this is where the problem comes. Unless we focus on health and what is this health insurance all about, you need to take charge. And employers and employees, they should educate everyone how to save money. Even for the city, they can save money by having a deductible health insurance for their employees with health savings accounts, which has a triple tax benefit. Contributions are tax deductible, withdrawals are tax deductible, and your appreciation on the account, if it's tied to a brokerage account or index funds, it's tax deductible. All right. The well category should not, the insurance premium should not be more than 50 to 100 bucks. Well category. If they have not seen a doctor for 10 years, 15 years, their premium should not be more than 50 to 100 bucks with a deductible. Obviously, if you have to have a deductible component to it to qualify for HSA. Second, there's a thing called second category where acute illness or so-called they're they're prone for certain, like smokers, diabetics, and people who consume have bad habits. Their risk, and people who are on drugs and mental illness. These are all people, they have certain risks. If they have a risk, that's a risk category in the acute illness category, or presumptively prone for these illnesses, their premium should be maybe 10% higher. And their premium should be based on that category, not broad over 300 million people. And they should be able to save money and put aside into the health savings. Third category is chronic illness. People who have chronic illness, they should, premium should be, these are the folks, they need constant care. And these are the folks we need to pay attention to, people with chronic illness and handicap, people with all the multiple problems, multiple illnesses. They're the one. There's a 15% of the population. I'm talking about 15% folks, 15 to percent of 12 to 15% of the folks have chronic illness. No more than that. No more than that. They should they should be well taken care of. These are the people we need to focus the attention to. And their insurance premiums also should be based on the chronic illness category. And it should not be any higher. It all depends on the usage. If you give the consumer the proper tools, consumer will try to save money by using the services reasonable instead of abusing it. And the last one is catastrophic. Catastrophic is something which is unforeseen. If you're a pilot, flying, or if you know if you're prone for accidents, things like, if you're, so anything catastrophic, that their insurance premium should be based on that. If you do that, consumers in the front line, when they have an HSA, they will watch out what they want to pay from their pocket, because HSA funds is theirs to keep. Having spoken about four categories which insurance companies refuse to accept, consumers have to demand. They are the one who can drive the cost lower. For example, everybody knows that if I have osteoarthritis, and everybody suggests I should go and have a arthroscopy, knee surgeries. I don't know how much it's going to cost, but my insurance is going to pay for it. My insurance is going to pay for it, right? So you don't care, but you don't realize somebody is paying. Ultimately, you are paying for everything what you're seeking. If you're going to have a knee surgery, hip surgery, hospitalization, and when you get the bill, oh, insurance will take care. That's not right. It is you. Ultimately, your premiums will go up next year. Everything will go up. What I'm suggesting here is, if consumer takes charge in the front line, if you have an HSA, you have a HSA account on the side. If you have 100, 200,000 in his bank, and he has a debit card, and would he go for the surgery? He will think twice. Like myself, I have arthritis. They've been telling me I need a knee surgery or arthroscopy, you name it. I refuse to have one. Ultimately, I've done my research. This is what the beauty about technology, man. Technology. What I'm suggesting, I did all my research. Me being a physician, yes, I understand. But even for a common folks out there, there's so much information out there on the internet, on your mobile phone, man. Just your mobile phone. Everything is there on your mobile. I did the research. I watched the YouTubes. I watched everything. I did say, okay, knee pain. What are the causes? Arthritis. What can I do for arthritis? Then they tell you all sorts of non-medical simple treatment. Exercise is good for you, simple. Whatever it is you need to do. But me being a physician, I did research that I need a stem cell therapy. Stem cell therapy, which is FDA has not approved it. So insurance companies will not pay for it. I don't know why the FDA is taking so long to approve it, but here we go. Here we go again. If the FDA doesn't approve it, the insurance companies will not pay for the stem cell. It is a simple treatment, folks. It should not be costing more than a couple of thousand. It's a couple of thousand. But here I am. I did the research. They say, they take the cells from the iliac crest and the fat, and they grow. Their bone marrow has a rapid. They have the stem cells. It has a regenerative power. What they do is they they culture these cells, and next day when you go back, they give these stem cells into your knee. They inject into your knee. Simple procedure wise is very simple, folks. I don't know why FDA is taking so long to approve it. Now, I I called several places. They say in Chicago, they say they can do this procedure for $9,000. It's still cheap, folks. I'm telling you, still cheap compared to having a knee surgery in a hospital, which is could be hundreds of thousands. God only knows, man. Because I have had a bad experience with the hospitals. If I go to the hospital, I will never sign anything unless I know what is my bill. Very first thing, they want to see the bill before I get discharged. I demand transparency. I want to know what my bill is. If they give me a discharging instructions, fine. Give me the bill before I sign anything. I want to see how much they're going to charge for every stupid Tylenol, aspirin. It is a scam, folks. The hospital billing is a scam. The billing, $12 to $15,000 per day, that's not acceptable. I can lower the cost, folks. There is a way to do it. You can lower it to 2,000, not 15,000. But anyway, that's a different issue. Right now, I have done my research in my regenerative so-called stem cell therapy. I called UCLA. They said 99,000 for each knee, so $18,000. I have to see this doctor. It's going to initial consultation is $300. That's also high. It should not be more than 100, $150. And they can bill my medical insurance, but they don't want to. I have no idea why. If I am the consumer, I'm going to file tooth and nail. They should bill my insurance. And if it's not approved by the FDA, then I have to pay for it. But I'm going to shop around. I'm sure there are stem cell therapies done all over, all over. There are ways you can get. I understand I want to go to a reputable center with a qualified physician, but I will do my footwork and make sure I can get it done for 2,500 if I can. This is my goal. I don't need the surgery right away. I can wait for 2, 3, 4, 5 years. I can take precaution because this is what the consumer does. He doesn't want to spend his money from his HSA. This is the ultimate goal of consumer-driven healthcare. I am not going to spend my money from the HSA. I have $150,000 in my account. I'm not going to spend it. I'll pay either from my pocket if I can afford it. Yes. And this doctor tells me he wants me to, okay, if he wants to do this procedure, I want him to do 9,000 for both the knees, not one, not per knee, because it's there's no extra thing anywhere. You can same thing what they is injecting into one knee, you can inject into the other knee. It could be done for even less than that, but I'm willing to have this done for $9,000 for both the knees. I might pay from my pocket. I will not use my HSA, but I take the receipt. And when the time comes, I can withdraw money from my HSA anytime. If I need cash, if I need to buy a car, if I need, I can use those HSA funds for whatever I need because I have all the receipts accumulated. This is the plan, folks. This is what I'm going to do for the rest of my life. I'll be fighting tooth and nail every time I get into these medical facilities. It is very first thing they ask you insurance card. The insurance card. I said no. I'm paying cash. I don't have the insurance card with me. I'm willing to pay cash. So the problem here it is every time the insurance you give the insurance, same $2,000 procedure, they bill your insurance companies $10,000. This is where the gimmick is. And the stupid, even the Medicare pays $5,000. And ultimately, who's paying for this? You. It's you are the one who's paying because your premiums will go up next year. Your supplemental will go up next year because you are responsible for what you do. So I want to watch the prices like a hawk. I want to see, I want the best healthcare at a reasonable cost. Yes. 90% of the doctors and hospitals have no idea. They have no idea what the cost of their care is. They use so-called charge masters. Hospitals use charge masters, folks. These charge masters as a basis for negotiating prices with private insurance companies. That's what they do. Hospitals, they use charge masters. These charge masters are not related to any actual procedural costs. The procedural cost should be based on number of times the procedures are done and how long does it take. So it has nothing to do with it. So the government, even the government, Medicare, pay hospitals based on artificial DRGs, diagnostic related. Who came up with this brilliant idea of diagnostic related group, DRGs? And doctors classify the diseases under the International Classification of Diseases. Who came up with this? Brilliant. Bureaucrats. ICDs, they call ICD-10. So these are all procedural, so-called classification of diseases. These are all numbers, folks. Basically, they came up with this. And doctors charge fees based on CPT codes, current procedural terminology codes. Again, these are all made up numbers, folks. These are all made up numbers. American Medical, this is the beauty. American Medical Association creates this proprietary CPT fees. So Doctors Association, American Medical Association negotiated with the government regarding this so-called DRG, CPT fees. current profit. I have no problem with that. But consumers are lost in the middle. Consumers have no say in this. Consumers, they have ignored the consumers, period. Consumers are nowhere. It's all insurance companies and doctors and hospitals. Consumers are nowhere in it. So the consumers have been, public has no input, and competition is irrelevant. Irrelevant. And free market is totally ignored, man, totally ignored. So the CPT codes form the basis of federal Medicare payments. The other day I went for an angioplasty, 23-hour stay in the hospital. My Medicare paid $35,000 for a 23 hour, and they billed the Medicare $227,000. Look at it. And the reason they billed it high, because they can collect it from the supplemental, the rest of it, the 20%. So Medicare paid 35, and the other one, they collected 50 to 60,000 folks, which shouldn't have been more than 10 to 12,000. Look at it. This is how the healthcare is so corrupt, so corrupt. Consumers have no say in this. Consumers have been totally on the wayside. Can you see this? They're all these medical charges are rigged from the with insider terminology and self-dealing amounts without the input from a consumer, without the input from free markets. One more thing you do, this is another. Do you know doctors cannot charge less than Medicare, less than the government paying this so-called managed care organization? They cannot, doctors cannot, because doctors are obliged by the Medicare. If they want to participate in Medicare, they cannot charge below the Medicare by law. Otherwise, they'll be kicked out of the Medicare. These are all insider games, folks. And doctors abide by the Medicare rule because they have to survive. They have to make it, they have to go along with whatever the Medicare does. And private insurance carriers upcharge based on Medicare. They upcharge, and that's how consumers have no input in this insider's game. Despite all this working against you, you need to lower your insurance premiums. Other side is the cost of the care. But how do you lower your insurance premiums? You can, as a consumer, you can influence your lower insurance premium. The insurance premiums are nothing but medical procedural cost times utilization. This is the way it should be based on. But they don't follow that. Each medical procedural cost and utilization. If you're a consumer, you haven't used and you haven't had any surgery, you haven't had anything for 10, 50, majority of the folks, I haven't had a procedure done for the last 40 years. I've never had it. Other than a diagnostic, I've never had it. But I've been paying like six, seven, eight, $900,000 because I am paying for the rest of the country, 300 million folks. That's how. If you want to make a living, that's what you do. And if the consumers take charge, he wants to fight that premium, bring down the insurance premium if you give them proper tools. Right now, consumers have no proper tools. They're never given an option of segmenting the diseases and demanding the lowering the insurance premium. So utilization is the number of times a procedure is used. That's how it has to be based. Consumers may not be able to directly set or competitively influence the cost of the medical service, but the customers can affect the number of times that services were used in the free market. Based on that, customers, if somebody is charging me for stem cell therapy $18,000, I will shop where I can get it for 9,000. I can shop where I can get it for $2,500. Yes, we have an option. I can get it done for $2,500. Believe me, folks, I have the power. I have the power because this is my money. And the insurance premiums have to be based on group impacts, personal impacts, and limited utilization of services. They have to be based on that. Right now, your premium is not based on any one of this, any one of this. They're all based on broad 300 million people who are, and even including the illegal Americans. Your premium is based on illegal Americans, unemployed. Your premium, you're paying for everybody. This is where your premium is based on. It's not segmented, folks. It's not segmented to you personally. Yes. Well, that's the way lowering the personal utilization can lower your premiums. Yes. And out of pocket costs you pay. Well, you can do it as a consumer. If you have a health savings account, you can reward for personal actions by not using your money to HSA. You would rather, I can believe you will have an HSA, you don't want to use it. You would rather pay it from your pocket, collect the receipts, and accumulate all the bills and withdraw whenever you want. That gives you the flexibility to withdraw, 10,000, 12,000, 15,000 from your HSA and go and buy a new car. That is you as a consumer can do that. As long as you have the bills, you have the receipts, you can withdraw that money. See, this is the beauty about health savings account, folks. This is the beauty. So lowering the insurance premiums are the real reason you need a personalized health insurance which uses the risk segmentation as the basis for the insurance premium. You have a right as a consumer, you have a right to purchase insurance associated with similar good or bad risk. Your premium should be based on similar good and bad. Why? You should be able to share in savings created by the pool of lower utilization of services. Yes. Pooling, pooling the pool risk into an impaired health support plans will lower the insurance cost for everyone. Yes, by pooling the impaired, like chronically ill, you will have lower insurance cost for everyone, rest of the folks. So I don't have to pay for 300 million. I'll pay for the lower risk category. So what happens? What are the cost distribution, folks? What are the cost distribution wise? Who are the stakeholders? Less than 1%, less than, actually 1% belong to a category so-called, actually it is acute illness category, who are people or smokers, or whereas 15% of the entire population, 15% they have they come under the categories. Up to 15% of them have a chronic illness, and they can be categorized into category chronic illness category, and their premiums have to be based on the chronic illness. Whereas majority of the Americans, 90 almost 70 to 80% of Americans are healthy. Their premiums have to be based on that. So impaired health support coverage is only 2 to 3%, folks. You mean to say we cannot take care of the 2 to 3% of the impaired health uh, people who can't take care of themselves? These are the folks, they need the care. We need to focus on these people who have to focus on the people who have chronic illness. So, what I'm suggesting is we have to fight as a consumer. We need to fight to lower the cost of the healthcare. We need to demand transparency. We need to demand affordability of health insurance premium. And we need competition, folks, not consolidation. The way the healthcare is going, everybody's consolidating. They're driving the competition. They're taking away the competition. Hospital mergers, group mergers. That's not the direction we need to seek. We need more competition. We are spending $3.8 trillion and we rank 37th among the most advanced countries in the healthcare delivery. And the cost for the first time has surpassed the national defense budget. What a shame. National defense budget. We are spending more than national defense budget. And in spite of all that, we rank 37th, folks. 37th. That's not acceptable. That's not acceptable. Let's focus on the consumer. Let give them all the tools they need. Demand affordable, demand competition, demand transparency. Every time from now on, if I check into the hospital, I need to see the bill. I really need to see the bill before I sign any paper. I need to know the cost before I get in. I need to see before I get discharged. This is what I want in the in our institutions. We need to, before they take you in, they need to tell us roughly how much the cost is. And when they discharge you, you need to see a bill, how much you're going to get. You don't want surprises, folks. Believe me, we are not looking for surprises. The surprise, this billing system has to be gone. This medical billing is a joke. 1,000 billing companies globally billing our American insurance industry. Can you believe? And all these thousands of billing companies minting, making millions and millions in billing. Who's paying for it? You folks. You. You are paying. And all this so-called Medicare Advantage, beauty, Medicare Advantage, management companies, maintenance organizations. Who is really benefiting from this? Middlemen. Middlemen are swindling. Medicare keeps 5%, gives 95, whatever it is, to the managed care organization. Your $1,200 every month goes to the so-called Medicare Advantage or managed care. What they take in, they keep 20% for the administrative costs, and the rest of the 75%, whatever they do, they say you need this authorization, that authorization. You cannot see this doctor, you cannot go to this place. That's how curtailing the services, they have to show profits. They have to show profits. That's how the insurance companies make money. And the insurance companies gives 75% to the doctors. Now doctors forming medical groups. These medical groups, They're getting a chunk of money from these insurance companies. Look at it, beauty. Medicare is paying directly to the medical groups. These are all unethical, folks, unethical. And what the doctors' groups are saying, they put more restrictions in the care, more restrictions, and restrict. And what they're doing now, they're consolidating because they can't. Medical groups are merging. They're buying smaller groups. Hospitals are merging. You're driving the competition out, and there's no transparency. I was told the lady who went for had a baby in the hospital. She got a bill for $695,000. She got a bill for 600. Even if it's a C-section, it doesn't matter what the procedure was for a delivery of the baby. 695. This is a scam, folks. This is a scam. Better wake up. People better wake up. We need to we need to stop it. We need to fight back. We need to fight back. We want consumers to be in the driver's seat, not insurers, consumers. Folks, thanks for listening. I'll keep bombarding my this is what my this is what this is. If you like what I'm saying, go to dollarcare.org. I'm trying to raise funds through a nonprofit, and everything goes back to the setting up of hubs. Basically, we want to provide alternative services where we can lower the cost for everyone, especially for the impaired. So, thank you guys. If you like this channel, subscribe, share, and make some comments. I'll try to respond as much as I can. But thank you and God bless. See you in the next segment.